Hello and welcome to Just One Q, the podcast where we explore the latest ideas in workplace belonging in conversation with thought leaders and experts. Each episode, a guest and I dive into a question that highlights their area of expertise. The goal is to leave you with the tools and insights you can use to make your workplace better and more human-friendly. I'm your host, Dominique. I'm an inclusion educator and advocate working for Dialectic, an inclusive workplace learning consultancy in lovely Guelph, Ontario, which is situated on the treaty lands and territories of the Mississaugas of the Credit First Nation and the traditional lands of the Chinongton and Haudenosaunee peoples. Today, we're talking about something that is tucked away in an HR handbook, but actually dictates who gets to be healthier, who enjoys more financial security, and whose kids get braces. We're going to talk about employee benefits. In Canada, the numbers look pretty promising on the surface. So 66.8% of Canadian employees and about 80% of full-time permanent employees now have medical or dental coverage through their jobs. And this is a figure that has been steadily climbing since about 2021. There are some have and have not divides in our system, though. So first of all, women are a little bit less likely to have coverage than men, largely because we're twice as likely to hold part-time roles that don't offer benefits. And younger workers are also less likely to have benefits because there are gig, temporary, or contract jobs. And for those who do have them, benefits can be a massive indicator of the quality of employment. In Canada, while we have universal health care, we do rely on employers for those extras: therapy sessions, dental surgeries, life-saving prescriptions. And in the US, that dependence is even more extreme, with employers footing the bill that is about 8 to 10 times higher than their Canadian counterparts, just to provide basic care in the absence of universal basic health care. So in both systems, variation in coverage can lead to disparity in health and financial outcomes. And beyond just who has access, there is a critical question of what the access provides. So for a long time, benefits have been designed for sort of a standard employee that may or may not really exist. So we're going to take a bit of an equity lens today and apply it to the question of benefits. And the question that we're going to use to anchor our conversation is, how can we design equitable employee benefits? And joining us to answer that question today is Kristin McCartney. Kristin is the Director of People and Culture at JL Richards, a firm that provides high-quality engineering, architecture, and planning services to clients in both private and public sectors. It is, not by accident, a Platinum Club member of Canada's Best Managed Companies. Kristin has more than 15 years of experience in HR, focusing on recruitment and selection, compensation management, leadership consultancy, and strategic HR innovation in professional services firms. She has directed the creation of countless initiatives that aim to support talent and culture, including formal career mentorship programs, wellness campaigns, and leadership development programming. She co-founded and currently serves as the co-chair of JLR's Diversity, Equity, and Inclusion Committee, spearheading new programs targeted toward the progression of equity-deserving groups, with a special focus on women's issues in a historically male-occupied field. She serves on a regulatory committee for the Human Resources Professional Association, HRPA, which guides the development of exam material for new HR professionals with a lens on the changing landscape of the laws and trends of the profession. And she is a founding member of the Horizon Project, a community practice for HR professionals, co-creating tools and resources with the objective of progressing women's workplace equity. So Kristin is very well positioned to have this conversation today. Welcome to the show, Kristin.
Oh, thank you so much, Dom. It's a pleasure to be here. Thank you for that very kind introduction. I feel very grateful to be here on your show today.
Fantastic. Well, you did all the hard work. I just get to list it. So thank you for being here. This is obviously a topic that I know you're personally passionate about. Maybe you wouldn't mind starting by just telling us, how did it become a focus for you?
Yeah, so my very first job in HR was in a benefits company. And so I was HR for the HR company. And I got a sort of accelerated learning plan into particularly how benefits can impact well-being. And, I think a lot of people think of benefits as just a perk. It's kind of, like you mentioned, part of the handbook. But that's not the world that we live in today. We live in a world where well-being is central to employee survival and to company survival. And so I really watched the shift from perk to sort of real life support from the benefits perspective from inside. So I got to see how pension splits work, for people undergoing certain life events and how, disability benefits get approved or declined and on what basis. And even things like orthodontics, you mentioned kids' braces, and it's just a wild world. And I got that deep knowledge from working there. So now in a leadership role in a sort of, male-occupied industry, sort of working toward understanding what different equity-deserving groups need from their employer in many different facets, and particularly, again, it's a sort of passion of mine in the lens of benefits.
Yeah, absolutely. So in the context of this industry that you're now working in, can you explain the significance of attractive benefits? Who is it specifically that you're trying to serve or include, and why?
Yeah, I think all professional services firms, this is not exclusive to engineering, but certainly it is present, is that there's a labor market shortage. And in many demographics, mid-career professionals, for example, or people who are going to retire, or young people, they have different needs of their employer. And so the labor market shortage in these different areas, we have to address it in different ways. And so benefits, as it pertains to these different kinds of people and the intersection of humans that exist in the world, in the context of engineering and in professional services firms, it's about trying to address the business reality, the sort of underscored goal of hiring the right people to do the job that you have.
Yeah, for sure. And I mean, like in general, it seems like the benefits landscape is evolving. We have a little bit more awareness happening. It used to feel very standard, cut and dry, but there are some changes and innovations happening to kind of bring more people into organizations and make work meaningful and rewarding for a wider range of people. Can you tell us a little bit about what you've noticed over the past years and in that change?
Yeah, so flexibility. And I think this goes back to the idea of intersectionality. There's so many kinds of people. And so the single benefits plan where you're sort of covered for $250 of massage per year for every person and everyone's in the same bucket, it just doesn't work anymore. In the world of big data, we have access to lots of information, and AI has made it easier for us to parse through that information and really make some meaningful connections in terms of what employees are using. So we're also able to compare what other companies are doing in the same industry or similar sectors. And that way we can figure out what nuanced changes can we make to our plan so that it better serves our community.
Right. And I guess the data that is collected now or that we have access to now and didn't previously, can it also help employers in terms of getting the most bang for their buck when they're paying for these coverage plans? Is that sort of an angle as well?
Yeah, absolutely. So some benefits are rated on use. So how many claims are made against a certain benefit, and then how many premiums have we paid? And of course, the insurance company is trying to make sure they don't lose money. Right. So then they set your premiums accordingly. And so it's really helpful for an employer to understand where are the high ticket items, which drugs are being used most often. And this even helps us to set other wellness programs if we notice certain trends with our employees' health.
That's really interesting. Yeah, that data wasn't previously available, and now we have a bit more insight. Obviously, it's going to make things a lot more easy to kind of tweak and personalize these programs. So you're saying more flexibility in general. What other types of plans or what innovations specifically are you seeing in the space?
Yeah, so flexibility for sure. And I think the flexibility goes along with culture. So it's really interesting that you can actually match your benefits plans now to what you value as a company and what parts of your, what segments of your population need so that they can thrive at work. So other innovations, the kind of plan, the sort of plan design, so things like cafeteria plans where your employees can sort of pick different options, modular plans where there's sort of buckets of potential coverages that are associated to different kinds of premiums, bicycle, Toyota, Cadillac, sort of
Sure. Yeah.
Look and choose what they need.
Cadillac,
Yeah. And then healthcare spending and personal spending accounts have been around for a long time, but we're seeing an uptick in employers wanting to offer these services again for flexibility because it's just sort of a whole list of things that you might want to buy with that money. And then we're also seeing a lot of cost sharing lately. And so again, I think this goes back to what kind of company are you? What kind of employer are you? Some employers are interested in the idea of ownership and accountability, making sure that their staff feel like they've got part to play in the bottom line. So this helps to share that around the firm, if that's the kind of firm you've got.
Oh,
And
interesting. So making it cost sharing gives employees an incentive to underutilize their benefits. Is that what you mean?
not quite, but it gives them the opportunity to pick what's right for them. So if it's a cafeteria plan, for example, and we're sharing the premiums, then an employee would pick, this is the right selection of benefits for me and my family, and it's worth this, the value is this.
Right.
So that's the change. And Dom, a couple other innovations, one of them particularly around executive preventative health, which is up and coming. And with the lens of DEI, especially in professional services firms, we find that these really cool programs, executive preventative being the programs that are looking at markers for aging and markers for preventing disease in the future, things like pre-screening for melanomas and all that. But of course, they're being offered to a very small subset of our population. So that it's emerging, and it would be really interesting to see that kind of service being offered to a wider subset of our staff.
Yeah, absolutely. You mentioned DEI really quickly there, but I would love to kind of flesh out that angle a little bit. I'm
Yeah.
wondering when you use that DEI lens, why should leaders be assessing their benefits offerings with a DEI lens? Like, what is the benefit of that in terms of how we're thinking about it?
Yeah. So I think we've spent a long time thinking of DEI as tack on or add on. How can I address one off questions reactive? So there's an opportunity here to really organize your plan in a strategic way that cares about all of your staff, from the systems approach. And so there's a push to integrate DEI into the actual policies and practices of your organization rather than just little additional moments throughout the experience. So it's an opportunity for employers to show what they really value, which is, different kinds of folks. And we'll talk about specific benefits later, I hope. That'll give you a sense of how we can really display our care about who employees are holistically, entirely, not just what they do at work.
Yeah. And there is sort of maybe a shift there in terms of what's expected from various employees, I'm guessing.
Yeah, for sure. I think we live in a world, like I said, where well-being is not optional. Well-being is important. It's critical. And if you're not showing your employees the support for their entire well-being, their entire human person, then you're not doing your job as employer anymore, it seems.
Yeah. Do you feel like you're seeing like a generational component to the feelings about benefits? Like, are there differences in what, traditionalists and boomers expected and what incoming generations are expecting?
Yes, yes. And I think those needs, that demographic need, can be addressed by this idea of flexible plans, right? It's not just the same plan for everyone. It's not even just the same plan for me 5 years from now or 5 years ago. Each plan shifts with each person's sort of journey through their life. On the retirement savings side, there's a sense of what people need when they're starting out, when they're sort of moving into having an amount of money ready to go, and then when they're kind of thinking about retirement. And so there's different lenses on the health benefits as well with that same approach.
Right. Yeah. So let's get into that a little bit. I want to maybe we can go kind of benefit topic by topic and
Sure.
see what we can unpack there. But yeah, so let's start with maybe family forming benefits because we were talking about that younger set who might be in the age where they're thinking about forming a family. So what specific benefits exist for people who are in that boat?
Yeah, great question. And this is one of the big ones, isn't it? So, first, I think what's important is that we need to avoid default assumptions about what a family is. And then when you set up a benefits plan, that's important, right? So, a family is not always a man, a woman, and 2.5 children. In fact, there's lots and lots of different variants of what families look like now. So, benefits in this space look like fertility treatments, education, about what's available, community services. It's broader than just sort of the IVF and IUI supports, adoption services, time off, who gets time off, how much and when. One of the major issues that I find with health plans is even if they try to cover family forming benefits in an inclusive way, they can miss the mark because some of the insurance literature is written for these sort of traditional nuclear families.
Right.
So, for example, IVF in certain cases, like fertility treatment, can exclude same-sex couples because often there's a sort of provision for them to have to prove infertility, which is
Oh,
impossible.
wow.
Yeah.
Right.
Yeah. So, a lesbian couple, for example, wouldn't be able to prove, in fact, they aren't infertile. They're just not interested in the traditional way in which people became fertilized before,
Right.
before we start talking about this.
Yeah, that's so
Um,
interesting.
mhm. Yeah.
Something
So,
for employers to be aware of, I guess, when they're choosing providers, right?
yeah, and employers can always adjust their plan text. They can request changes in fact, they should. Employers are the ones paying the insurance companies. They're the ones who can decide what they want to pay for. It's just something to look for in the text, or even ask your broker or your third party to look for you with this lens.
Amazing. So we touched briefly on, LGBTQIA identified employees in terms of family forming benefits, but are there other types of benefits that employers should consider just to expand availability of services to that group?
Oh, sure. Yeah. So gender affirming care, surgery, hormone therapies. And then again, just like in family forming, this importance of the sort of social transition. So education, community supports, therapy. There's lots of different benefits available. And like you said earlier with the big data, it's great to be able to figure out what your competitors are doing so that you can figure out what to include too.
Yeah, absolutely. And I think an important thing to mention here is like, I'm wondering if employers sometimes feel like, well, this doesn't apply to me or this doesn't apply to my company. What would you say to those people who maybe aren't aware that some people who fit into non-traditional buckets might be in the company and they're not necessarily seen?
Right. Well, and part of the reason that they might not be there or might not be seen is because they're not seeing themselves reflected in the policies and programs in the firm. So again, removing this sort of lens from perk add-on into the sort of system and program and the ethos of the firm. So when it's written in our benefits plans and people who need to see it can see it, then they'll make themselves more visible too.
Right.
And you might end up hiring more people who have different diverse viewpoints too.
Absolutely. Yeah. I think that's it's such a clear case for when a type of benefit signals your culture, really, and the degree to which you're willing to be inclusive in other areas in your company. It
Yeah.
is kind of this signal, and it's visible right away because it's like at the very beginning of your employment. You have this kind of documentation in front of you. You have to agree and sign on. And so it is an opportunity there for sure. Um,
Yeah.
yeah.
We talked about dinner conversations, me and my HR friends and my team. And what we mean by dinner conversations is what is the thing that someone's going to talk to their kids, their spouse, their parents about when they go home?
Mm.
And it's, what did my boss do today? Or what cool project did I work on? But sometimes it's, I read this thing in the benefits program that says that we support gender transition. And I just thought that was such a great thing for my employer to care about. So we think of benefits often, in my team anyways, as dinner conversations.
Nice. That's a cool lens to bring to it. I wish I had benefits worth talking about at the dinner table. Maybe I need to dig up my handbook and have a look because I could be missing something.
Yeah. And the funny
Spice
thing
up
is
my dinner parties.
yeah. Well, yeah. And the funny thing is, Dom, is they're one of the cheapest ways that employers can add dinner conversations.
Sure.
It's not very expensive
Right.
for the impact it can have. And,
Yeah.
and it could be social media conversations. It could be, in the new age, it could be all kinds of different ways that people talk about it, but it gets you talking about your employer. And that's ROI for me.
Yeah, absolutely. Positive press. Yeah. So in another area or another group, perhaps an area of emerging interest is neurodiversity, right?
Mm.
Because of the prevalence of autism, ADHD, and other forms in employees and also in their kids. So if we consider neurodiversity in benefits, what changes do you think we should be making there?
Mm-hmm. Yeah, I read a study that said something like 15 to 20% of the population is neurodivergent.
Yeah.
Here in engineering, you won't be surprised to hear that most studies say it's higher.
Mm,
So this is absolutely poignant for benefits plans, appropriate and diverse paramedical services. Paramedical are the things like the massage, physio,
right.
and mental health providers, so psychotherapists and therapists and social workers. And this is another opportunity for employers to look at their plans and see who am I covering, what kind of provider, because there's often many specialties that aren't covered by the plan. And so an employee would go visit their specific therapist and just to find out that that one isn't covered, that kind isn't covered.
Right.
Yeah, and then virtual care becomes really important in the neurodiversity space because often it's very lengthy, the waits for these kinds of practitioners. I've just listened to a different podcast. I was cheating on just one cue, I'm sorry, where they were talking about the sort of shortage of therapists and mental health practitioners, leading people to go talk to their GPs about
Sure.
mental health because that's the only place they can talk about it. So virtual care, the sort of service you can get anywhere is important. Um, yeah, this is one of those areas that definitely always shows up at work, whether it's yourself or your kids. You can't come to work and turn it off, right? It's part of your fabric, it's part of your ethos.
Yeah, absolutely. I'm a parent to neurodivergent kids, so I would have to agree with you. It affects me deeply, even though it isn't me. It's the things that happen on the outside. There's a lot of flexibility that I need in order to be fully present, but benefits are also a big part of that, where access to services has become so important. And especially, in Ontario, we have major gaps in what's offered publicly. So it's important to kind of try to fill those whenever possible. It's like 60,000 kids right now in Ontario waiting for Ontario Autism Plan funding at the moment, which is a total travesty. Yeah, but I think employers have a huge in to make a big impact in people's lives in that area. Um,
Absolutely.
yeah. So what other things, when you have talked about a couple of them, but what other things should we be considering when it comes to equity in health benefits? Who have I left out? What am I missing?
Yeah. So the thing that comes to mind immediately is traditional medicine. Indigenous employees rely on, cedar, sage, sweetgrass, tobacco, and other kinds of ceremonial items, visits to the sweat lodge, healing circles, smudge kits.
Mm,
So there are options for this. Personal spending accounts and healthcare spending accounts can cover some of these items. But again, it's just paying attention, right? It's
yeah.
looking at your formulary. What does it cover? What is it missing? Asking your broker, how can I make sure that I care about our Indigenous employees and their medicinal rights? So naturopathy is another way in which we can cover certain Indigenous services. So that's another provider that we can add to the formulary. And formularies that include traditional prescriptions. They don't necessarily have to be written by sort of MD GP, but they could be written by a traditional medicine doctor.
Or a naturopath, I guess.
That's it. Yeah,
Yeah.
exactly.
Yeah.
Yeah.
Awesome. And I guess another angle here is like we don't often think about religion as impacting benefits. Can you take us down that road a little bit and tell us what we're missing there?
Yeah. So maybe I'll shift into the sort of retirement savings side.
Sure.
Um, I think so. The first thing that comes to mind is Sharia compliant funds. There are rules in Islam that prevent Muslims from contributing to certain kinds of savings plans,
Mm,
and so all of the big five brokers, your Canada Life's, your Sun Life's, whatever, all of them have got at least one Sharia compliant fund. This means that Muslims can take part in your benefits plan, your retirement savings plan. I think it's little known, and I know it's little known because only 0.5% of plans actually do include Sharia compliant funds, 0.5%.
wow.
Um, yeah, and it's not just Islam. There's a sort of concept of right livelihood in Buddhism, even in just the major Catholic religions. There's this idea of being sort of responsible, biblically responsible, and not contributing to things like guns and violence and
Yes. Yes.
oil. And then I think it's just about coaching, individual coaching, and asking questions of people that come in. What can I do? How can I help? And so, in the lens of religion, it's just about learning and sharing information with your staff.
Yeah, absolutely. Religion is something that we've talked about here at Dialectic. Off and on, we have some training programs available about religious inclusion. And I always bring up Brian Caruana from Encounter World Religions, who offers amazing training and like immersive training for employers and for anybody to go and actually visit places of worship, interact with people, have all your questions answered. And his lens on it is that it's sort of like the untouched frontier of DEI. Like we just don't talk about religion. People are kind of uncomfortable about it in ways that we are now comfortable talking about other things like neurodiversity or race are sort of, have become mundane. And religion has this little quality of being bridge too far or like too almost political or something. But I think normalizing that and having those conversations about religion, it's always so rewarding. The things that you learn and the ways that you're able to connect with employees and with your peers when you are able to respectfully address those. So I'm happy to hear religion in this mix. And that's, a very valid and important and central part of a lot of people's identities. We're not in a secular society, even though we sometimes have pretended that it is that way, right? Like individuals are practicing all kinds of religions and it does deeply affect things like even their retirement savings, right? Who would have thought? But there you go.
And the cool thing too is, as you were talking, I was thinking about our employee resource groups. Most employers would have something to do with employees kind of organizing themselves around shared values, one of them being religion. We have one for immigration. Immigrants, in engineering have a hard time sometimes navigating some of the regulators and getting themselves licensed. So we have a group at our firm that helps immigrants to understand the variety of resources available to them and how to navigate it. And in doing so, we've sort of inadvertently put together a group of folks who practice different religions.
Right.
And so we ask them questions all the time about, if we were going to plan a party of this day during Ramadan, would that be okay?
Yeah.
Things like that. So partnering with ERGs, I think, is a great way to get to know your employees too.
That's fantastic advice. So we were talking briefly about, the savings plan portion. Are there other ways to address equity in savings plans?
Okay, so we've all heard of first generation Canadians, but I think there's also this term I just heard, first generation professionals. So it's this for the first person in their family to graduate.
Right.
And what does that mean in terms of their knowledge of savings and where they learned how to build equity and invest in their future? So further intersections, like maybe they're Black, Indigenous, disabled. And so that sort of intergenerational inequity and wealth knowledge paired with their intersections along different human rights aspects can cause a significant decrease in their knowledge and savings. So how can employers help? There are options that make it easier to participate in plans. One of them is called target date funds. So these funds set a date in the future when you might retire. So if you're 20 now, it'll look ahead 45 years and say that's when you're likely to retire. And as you get closer to that retirement date, the fund will become progressively more conservative so that your money over the course of the time that you've invested has the opportunity to grow and then get safer. And that's sort of one of the gold standard ways that we can take care of people who don't know much about investments, is they're still involved, they're still in the plan, and they still have an opportunity to have a big windfall. But then we're going to save their money by the end of it through the stewardship of the plan. There's also, different ways to address equity. This was your question, how can we address equity in savings plans? I'm thinking about environmental, social governance, those kinds of funds, setting up your plan so that it cares about the world and not just picks the best, funds that are going to outperform the other funds. What are the things that you're going to consider when you're choosing the funds in the plan? And I think also in savings plans, individual coaching is just as important here for all employees, for anyone at different life stages and different intersections than it is in the benefit side too.
Yeah, those are all really great pieces. I think they're also valuable, and people can, I really like how you've brought this idea of the first generation professional into the conversation. It's not something I don't even think that's like a term that I've thought of before, or that I've heard before rather, but it's so valuable to think, not everybody comes to the table at the same level, and not everybody can have the same life given the same benefits at work, because there might be a gap in knowledge and access to services for investment assistance and all of those things. So that's really great. So if employers, are doing the legwork of getting all of these various health and savings plans into place, what can they do to make sure that they're actually accessible to employees and encourage uptake? Because I'm guessing that that's an issue where you don't always, it's not necessarily if you build it, they will come. Like there might be some gaps in terms of uptake for certain programs.
Are you saying not everybody cares about benefits as much as I do?
That's right.
Yes, of course. There's lots of ways to make sure that everyone sees it. First of all, I would say, publish it. Don't be shy. We have our benefits plans, broadly displayed. You can see often social media feeds will have either employees or maybe their plants from HR saying, hey, I just did this cool thing. So if you're an employer and you're looking to make sure your employee sees your benefits plan, the first step is make it visible. Put it on the, cork boards, put it on the hubs, the intranets, the places your employees frequent. As far as the plan itself, I think one of the first steps is to sort of broaden the definition of benefits, broaden the definition of well-being. We talked about sort of financial well-being, caregiving benefits, preventative benefits, social connections, benefit of sort of mental well-being in the realm of society. So I think when you think bigger, then more people will come, right? When you think in different vectors and lenses about what benefits are and what they could be. And there's lots of companies that support sort of well-being banner, the idea that it's not just health and dental and retirement savings, but well-being is a sort of holistic concept.
Right.
And then specifically too, I think, first of all, we have to make sure that the language is inclusive and doesn't disqualify people. We talked about that sort of nuance around fertility. So reading your whole plan or having AI read your plan and say, show me where the language is inaccessible. Things like instead of both sexes, we would encourage our plans to read all sexes, or instead of opposite sex, it says a different sex.
Yeah.
Instead of wife or husband, it says spouse or partner. Things that just allow for more people to access the service, and it doesn't let the insurance company disqualify people that you didn't intend to disqualify.
Right.
Yeah, maybe just one more thought on that. The idea of data, we talked about earlier, the idea that we can find out really easily now which benefits are underutilized, who is using them, what demographics are using certain things, and then should we add more or less, and how do we make the sort of plan match the needs of our staff so that we're not paying too much, they're not paying too much, the insurance companies get to pay what we need them to pay. I think the last frontier on this too is that HR doesn't need to have the megaphone, but what we do need to do is to educate our leaders, other people around the companies, your line managers, your senior executives, on the benefits of inclusive benefits and having them understand deeply why certain parts of the plan work the way that they do, helps them to propagate the message that these are useful tools and that we care about our staff holistically.
That's great advice. All really great advice. I mean, you don't think that people would forget to use their benefits, but I'm sure parts of it are underutilized. So that's a really great reminder to sort of check in, see who's underutilizing things, and encourage people to use it. Actually model the use of the benefits and actively encourage people to take advantage of the things that are available to them. I don't think I've ever been in a workplace where that has happened, but it's definitely something that I can see being an advantage from an equity perspective for sure. Absolutely.
Tell stories, right? If I tell a story, then maybe someone will tell that story, and then maybe those stories will make their way into the common knowledge.
For sure. Yeah, absolutely. Well, all very great advice. Kristin McCartney, thank you so much for talking with me about this today. I have actually learned quite a bit, and I'm sure a lot of our listeners will as well. So it's an interesting conversation, benefits from a DEI lens. Yeah. Thank you so much.
Thank you. Thanks for having me. This was awesome. I will talk about benefits all day. And I'm really happy that this podcast exists and that there are so many different ways that we can support all of our employees and all of your listeners too.
Amazing. Well, thank you. And if you'd like to follow along with the great work that Kristin is doing, you can follow her on LinkedIn, and I'll drop a link to that in the show notes. And if you like what you're hearing on Just One Q, we deeply appreciate a quick follow or review wherever you get your podcasts. I'm Dominique. Thank you so much for listening, and see you next time on Just One Q.